Welcome back to the Aesthetic Blueprint, the official podcast of Symplast, the all-in-one platform for medical aesthetics and plastic surgery. And my name is Jessica Wisner. I'm the head of client education and product evangelism here at Symplast. And today I am thrilled to have the incomparable Dr. Stephen Williams on the podcast with me.
I'm happy to be here.
Yeah. So, Dr. Williams, I know you're a frequent flyer of our program.
Yes.
But, here we are at PSTM 2025.
And welcome. Thank you for coming. We always appreciate when high quality companies show up and, the members really see huge value in what you guys are offering right now. So,
yeah, no. And I tell you what, the traffic to the booth has been phenomenal, in no part thanks to you, of course. But, I love this conference so much because of the topics that are covered.
Yes.
And you kicked it off on Thursday with the new innovation. Was it new innovations? What were you?
Yeah, hot topics.
And hot topics.
Yeah, and hot topics is kind of where the things are going to change plastic surgery, the things that change how we're able to care for our patients. That's where they first show up. Mm-hmm. And I'm a tech person. I believe technology scales wonderfully in terms of solving the things that our patients need. And I had the opportunity to talk about AI and something that you guys are doing, which is really, really great.
Yeah, no, and full disclosure, we partnered with you and got some feedback on some new things that we're developing here at Symplast, and you were able to demo to everyone during your little talk. So I would love to just touch on, what you covered during that little 5-minute topic and, where we're headed with AI and how plastic surgeons are, of course, going to incorporate it to improve patient care.
Yeah, the two things that are in the news are GLP-1s and AI. And so you guys have chosen 50% of the entire, media attention. But the reason why is because, the only thing that really solves patient solutions at scale is technology. And AI is a little bit of a buzzword in some places, but the places that we're really going to feel it and see it first have to do with some of reducing the administrative burden that physicians feel.
Yes.
And so that means safe and competent interactions with patients, appointment reminders, scheduling appointments. And then the thing that I use in my office all the time is AI transcription and dictation of my encounters. And the wonderful thing about that is it allows me to focus on the patient. It allows me to focus on the exam and not worry as much about the record keeping.
Yes. I mean, because that's such a burden. I mean, the time suck alone, right?
And, this is, as you know, this is an incredibly rapidly moving field. And when I talk to the other EMR companies and the other people in the technology spaces, I think everybody recognizes that type of transcription, that type of record keeping is essentially the bottom level now.
It's the bare minimum.
It's the barrier to entry at this point, right? And so, the reason I use Symplast and, full disclosure, again, we have partnered together, but
yes.
At the same time, the reason we've chosen you as a partner is because I love the innovation. I love the technology. And, the thing that we presented yesterday was just super cool. And I got tons and tons of positive feedback about it. So,
yeah, well, and I think that it was really fun for me and the developers to kind of put our heads together because we've been playing with several different ideas of how we can use AI throughout the product to make you more efficient as practitioners. And, we were able to present you with a couple of different solutions, and it was really nice to get your feedback in the moment.
I think that, as people continue to try to develop systems that are better and more efficient, it's easy to kind of, after the dictation transcription part, it's easier to say, well, let's throw a new bell or whistle on that maybe doesn't really make a difference. Mm-hmm. And so one of the differences for Symplast is there's really been this specifically designed transition. There's really been a thoughtful process about what's the next thing that patients need. And I've kind of teased it already through our conversations, but
yeah,
one of the things after just booking the consult, documenting the interaction is needing to review that information. And I think you're calling it a co-pilot, is that correct?
Patient co-pilot, yeah.
Patient co-pilot. I mean, and that's really what it is. It's the ability to just have a box and you say, tell me about this patient, tell me the last 3 visits that she came in, tell me what size implant she has, and tell me her date of surgery. And just have that kind of all be there and be available. It's just, what a great time saver, because every single plastic surgeon, every single physician half the time before we're walking in to that patient exam room, we're like, well, wait a minute, what was this? And half the time
Yes.
we've got to spin back around and find, no, I pull up my iPad. I'm like, I've got to look before I walk in. I got to make sure I know the implant size, because to be efficient, we're seeing so many patients.
Yeah, it's hard to keep up.
Yeah, and it's critical that we're still delivering a high level of care and that volume doesn't compromise the patient experience. And so part of that is being cognizant of every part of the patient record and having that at your fingertips. It's transformative. I haven't seen AI applied that way in the EMR, and so super happy to present it. And it was very, very exciting, this ability to ask free-form questions and get real answers based on the patient data within the EMR. It's fantastic.
Yeah, I think, where we started from is, in my mind was we already made the patient summary, right? The AI patient summary. We've had that for a good year now.
Yep.
And it was like, well, how do I take that to the next level? And when I'm on demos, and I can even think back to my time on the practice side, I have very vivid memories of the provider I worked for with paper charts back in the day.
You're dating yourself a little bit.
I am dating myself just a touch, but paper charts and literally flipping through them when he had a patient he hadn't seen in maybe a year or 2 years, and having to reintroduce that patient to himself and be able to walk into the room like no time had passed.
Right. And obviously, we all care about our patients. We all develop relationships with our patients that are generally very positive. I think the challenge is knowing those very specific details that are critical for their care. And in the old days, we still had to know it. So it just meant that you had to study a little bit before you went in and talked to that patient.
Mm-hmm.
But this makes it so much more efficient. And that's really AI's promise, at least right now, is improved efficiency, so you can spend time, energy, effort, and resources taking care of your patients.
Yeah, and I think that's what it all comes down to at the end of the day is, AI is a tool. It's not necessarily, and I've said this on several podcasts I've done already, it's not necessarily replacing humans. It's making us more efficient so we can have better human connections.
100%. And, again, I'm not trying to shill too much for Simplast, but you guys have done a really good job about it. I think you've been very, very thoughtful about it. And that's why it's been something that's been a pleasure and easy to kind of to stand behind and to talk to other people about, other plastic surgeons.
Yeah, I mean, if I were to, kind of wrap up our conversation, I do still have a lot of physicians I talk to that are hesitant about bringing AI into their practice. Of course, there's always, the legal implications and those types of liabilities that are a concern. But what would you say in response to that?
Yeah, I think, I think caution and making sure you're choosing the right partner for your technology is incredibly important, because these are patient medical records. These are patient lives that we're dealing with. And so the systems have to be reliable. They have to be secure and HIPAA compliant. They have to be available. But, those people that are still walking around with paper charts, I just say, look, if you're using Google, you're using AI at this point already. And so you might as well do what other major corporations are doing and find those tools that help you take better care of your patients. Find those tools that enhance your mission. And that's what we're doing at our practice in Northern California.
Yeah, I love it. Well, and you have such a fantastic practice. I am excited to come out again and
You
bring
guys
it to.
are always welcome.
Yes, and bring one of my developers with who has been itching to come to practices. I was like, I know the exact perfect one to bring you to, and he's part of our AI team. So
we love technology. We love developing tools that better serve our patients. And so you're always welcome at Tri-Valley Plastic Surgery.
Yeah, I love it. Well, Dr. Williams, I want to be respectful of your time, but I am so glad we had these 5 minutes together just to sit and talk shop a little bit about AI. And I'm so thrilled about the response that you got during your talk the other day, because it just tells me we're on the right path.
Yeah, and get is probably the right word, because people are still pulling me aside talking about it. And so
fantastic.
It's really congratulations for work well done and for really good insight into how to continue to expand what EMR is going to offer our patients and help us to do our jobs better.
Yeah, thank you so much. And it's just the tip of the iceberg, really. We have so much we're working on in the back end. And again, not to, totally shill for Simplast, even though that's, where we're here for this podcast. But I, shout out to my developers and other product managers. We're really excited about what we've been building. And we're so fortunate to have a partner like you to give us that contextual feedback and help us really push the envelope.
Thank you. I'm looking forward to what's next.
Yeah, fantastic. Well, thank you so much, Dr. Williams.
Real pleasure.
Have a great rest of the show. And I will see you on the next podcast.
Sounds good. And I'll see you at our practice.
Yes, very soon.
Very good.
Thanks.
Thank you.
We'll see you on the next podcast. Thanks so much for joining.
Bye.